Joining me now live is the New South Wales Deputy Leader of the Opposition, Prue. Prue, good morning. Thank you for joining us. Just firstly on this proposal to halve the isolation time for asymptomatic people to 5 days, is that something that Labor would support?
Well, I mean, obviously we're not privy to all the health advice, and we would urge the government to follow the very best health advice. We hear this morning that that may be presented to National Cabinet next year. We would just urge for that to be done expeditiously, and for whatever the health advice that is presented to the federal and the state governments, that is followed. There's no doubt that isolation and all the impact of everything happening at the moment around the country is not only crippling businesses, small and medium businesses across the country, but people are sort of rapidly not being able to keep up with all the changes to all the requirements. So we urge the government to follow the health advice, and most importantly to get on top of the absolute mess that is the testing regime at the moment.
Well, we've just had some breaking news in, as our viewers can see at the bottom of their screens, Queensland to drop the PCR testing requirement. Of course, that's the 72-hour before arrival into that state, that requirement. That's big news, Prue. How big of an impact will that have?
Well, hopefully that does lessen the impact that we're seeing right across New South Wales on PCR testing clinic lines. We would still urge the government to open more of those clinics. We know a lot of people, I know in my own community, I'm being inundated with people who are saying they're getting positive rats if they can actually get their hands on one, on a test, and still stuck in lines for 5-6 hours with young children who are unwell. So let's hope that that limits the lines across the state, but it's still incumbent on the government to open more testing clinics, resource the health system properly, because it is at a breaking point at the moment. I think Dominic Perrottet was on Sydney radio yesterday saying it was all under control. He's on another planet, living on another planet if he thinks that's the case.
You mentioned rapid antigen testing. Obviously, there's a significant interest in this. People want to get their hands on these testing kits as quickly as possible. Whose responsibility is it to procure the rapid antigen tests?
Well, we see this morning that the New South Wales government is saying that they've put an order in for 20 million or something like that, rapid tests to arrive by late January. How is it that we're only ordering these rapid tests now? It is simply unacceptable that these haven't been provided free of charge to people in New South Wales. Scott Morrison has been too slow to act on this, and Dominic Perrottet has only done so because the community was calling on these rapid tests to be made available. People want to do the right thing. We can't ask people to be tested when they can't actually access either way to get tested. They're stuck in lines for centres, PCR centres that are often closed at this time of year, even though they really shouldn't be, and they can't get their hands on rapid antigen tests.
Do you think it's also a case of just bad timing, the Christmas holiday period, the unexpected Omicron announcement or arrival in Australia? Can we use that as an excuse for having these limited resources right now?
Well, it's definitely bad timing, but I don't think that that's an excuse for any government for the lines that we're seeing 5-6 hours at testing clinics across New South Wales. The Minister for Health got up only recently and said that modelling suggested that we'd have 25,000 cases a day. If they knew that, how did they not resource the system properly? We're almost 2 years into this pandemic. We knew that the combination of new strains, opening up and requirements to go interstate would put pressure on our system, and they should have resourced the health system accordingly. It's a breaking point right across the state. We're only seeing a government now scrambling to find rapid antigen tests when they should have done that months ago.
Prue, we have to leave it there. Thank you so much for joining us this morning.
Thank you.